welcome, and then I will speak off.
Sir.
Sir, how to maximize this? Can everyone see my face?
I
Suresh,
think, sir, your video is not
Sir.
there. I can able to hear you, but your video is not there.
What I have to start my video, I have to click that button
Yes.
to start my
Yes,
video.
yes.
Okay.
Yes, yes.
This is new app for me. Before that, we are conducting many that things through Google Meet.
Yeah, okay. I think you joined
Only.
your mobile phone, am I right, sir?
First time I use app. Any
Okay.
topic about adult discussions. So mainly before that, before you want to discuss, I just want to know the discussion purpose is based on clinical or how we have to interact is based on clinical based or studies or theoretical based. What is the exact needed for derivations?
So both you can combine, you can present your content, and we will begin formally. As you wish in the flow, you can take up your session, sir. Now I request Dr. Chandra, go for welcome address.
Thank you, Suresh sir. On behalf of the core team, Mental Health Webinar Series, and the organizer, the Department of Psychology, the American College Madurai, and the associating partners, Madras School of Social Work, Chennai, MS Chellamuthu Institute of Mental Health and Rehabilitation, Madurai, Red Pond Educational and Psychological Research Center, Madurai, Yellow Pond Counseling Center, Madurai, and Psycho-Oncological Association, Turkey. We happily welcome you all to today's session this evening. We also welcome the resource person of today, Dr. Chandra Bose, who is a consultant psychologist at Thanjavur. So thank you so much for accepting our request and being here. And now I request Dr. Suresh Kumar sir to introduce the speaker and talk a few words about him to the group. Thank you, sir.
Thank you, Dr. Chandra. Very good evening, one and all. I'm really happy to introduce my friend and well-wisher. And we were debate a lot of time regarding the psychology. I'm really happy to speak about Dr. Chandra Bose. Basically, he's a clinical practitioner and he was fascinated in the field of psychology. And he joined a master's in psychology as well as in PhD at Annamalai University. These were the academic credentials. When come back to that, in almost all the television debates, it may be on Niyanana or Tamila program, and if it is related to mental health or psychology, and he will be the one of the person who will be there for giving his inputs. So he was most invited persons for such a debate. And I would like to say that I would like to record here in this forum. In Thanjavur is the area where we can find out very less number of psychologists are practicing. And practicing psychologists very less in number, but when you take up that number of cases are more, because I had an opportunity being associated with 108, where I found that more number of calls I received from that area only. And he's the one person, he is qualified and well experienced in the field of mental health. In that area, I'm really happy to introduce Dr. Chandra Bose. And we prepared for examination, and he know that reality. And when we were discussing about the reality about that client, most of the time when they come and he used to give all the learnings he had in 5 to 7 years of thing, and they will say that bye-bye without paying any consulting fee. So that if he asks a consulting fee, some of them they will say that why we have to pay for that. So such a debates there, and he's the one, and he given okay, if you wish, you found that it is unuseful, you can give. If not, you can go. So such a wise person here, and he is going to share about that mental health of young people. Sir, we are really eagerly waiting for you to listen from
you. It's not like that, but anyhow, thank you for giving me the opportunities. So usually, எனக்கு வந்து through interactions with bilingual or mainly வந்து தமிழ்ல இருந்தா இன்னும் கொஞ்சம் பெட்டரா இருக்கும்னு நினைக்கிறேன். So I will try to convey in both Tamil and English. So வித் ஒரு பாசிட்டிவ் ஒரு ஸ்டோரிஸ். ஸோ இது நான் ஃபேஸ்புக்ல பார்த்து பிளஸ் எங்க டாக்டர் கிட்ட நாங்க ரவுண்ட்ஸ்ல பேசுறதெல்லாம் இதுதான் மெயினா. ஸோ எல்லாமே ஒவ்வொருத்தர் அவங்கவுங்க ப்ரொஃபஷனலா அவங்கவுங்க ரொம்ப சூப்பர்வா இருப்பாங்க இல்லையா? இப்ப நம்ம ப்ரொஃபஷன்ல மெயினா ஒவ்வொருத்தர் அந்த ஹெட் வெயிட் இல்லாம இருக்கிற ப்ரொஃபஷன் தான் எப்பவுமே பெஸ்ட். ஸோ எப்பயுமே வந்து எங்களுடைய சீஃப் சொல்ல பெருசு நீ தான் பெருசுன்னு எப்பயுமே மெடிக்கல் ப்ரொஃபஷன்ல பர்டிகுலரா மென்டல் ஹெல்த் கேர் ப்ரொஃபஷனல் அப்படி பண்ணவே முடியாது. ஸோ அது நாங்க எப்பவுமே இன்ட்ராக்ட் பண்றப்போ எல்லா டாக்டர்கிட்ட இருந்து எல்லாத்தையும் கத்துப்பேன். ஸோ அப்படி கத்துக்கிட்டதுல பர்டிகுலரா இந்த அடல்ட் ரிலேட்டடா நம்ம டிஸ்கஷன் பண்ணோம். ஸோ பிஃபோர் தட் என்னுடைய சீஃப் எனக்கு சொன்னது பிளேடு இருக்கு, கோடாரி இருக்கு. ஸோ பிளேடு வச்சு ஈஸியா ஷேவ் பண்ண முடியும், மண்டையை முட்டை போட முடியும். பட் ஆனா கோடாரியை வச்சு முடிய கட் பண்ண முடியாது, சேவ் பண்ண முடியாது இல்லையா? ஸோ பிளேடு வந்து ஸ்மால் திங் தான். அதே இது கோடாரியை வச்சு இட்ஸ் அதுக்கு உள்ள ஸ்பெஷலைசேஷன் இருக்கும். புரியுதுல நான் சொல்றது? உங்களுக்கு புரிஞ்சிருக்குன்னு நினைக்கிறேன். குரங்கு வந்து குரங்கு யானை கம்பேரிஷன். குரங்கு வந்து குரங்கு ரொம்ப ஜாஸ்தி. ஸோ அதனால நம்ம ஈஸியா இவங்க தானே அவங்க தானே அப்படின்னு நம்ம ஈஸியா அண்டர் எஸ்டிமேட் பண்ணக்கூடாது அப்படிங்கிறது ஃபர்ஸ்ட் பிகினிங்ல என்னுடைய வேர்ட்ஸ். ஸோ அது மட்டும் இல்லாம சைக்காலஜி வந்து ஒரு பெரிய ஒரு கடல் மாதிரி, ஒரு ஓசன் மாதிரி. அதுல நம்ம கத்துக்கிட்டது ஒவ்வொருத்தர் ஒரு யூனிக்னஸ், ஒரு இண்டிவிஜுவலிட்டி இருக்கும். ஸோ என்னுடைய individuality is different from others. So அதனால என்னுடைய வே ஆஃப் இன்டர்பிரிட்டேஷன்ஸ், நான் அனலைஸ் பண்றது, நான் டயக்னோசிஸ் பண்றது மோஸ்ட் ப்ராபப்ளி நியர் நார்மலா இருக்கணுமே தவிர டோட்டலா ஃபார் எக்ஸாம்பிள் ஆன்சைட்டி டிசார்டருக்கும் ஓசிடிக்கும் ஆன்சைட்டி நம்ம டிஃபரன்ஷியல் டயக்னோசிஸ் பண்ணிக்கலாம். ஃபார் எக்ஸாம்பிள் ஜெனரல் ஆன்சைட்டியா இருக்கலாம், அல்லது காமன் ஆன்சைட்டியா இருக்கலாம், அல்லது ஸ்டேட் அந்த மாதிரி எது ரிலேட்டடா இன்ட்ராக்ஷன் பண்றோமோ அது ரிலேட்டடா டயக்னோசிஸ் பண்ணி கிளினிக்கல் டயக்னோசிஸ் பண்ணி ட்ரீட்மெண்ட் கொடுக்கறது இஸ் ஃபார் பெட்டர். ஃபார் ஓவராலா ஆன்சைட்டியை கொண்டு போய் ஓசிடியில் இன்டர்பிரேட் பண்றது இட்ஸ் டோட்டலி ராங். ஸோ அதனால நம்ம என்ன மெயின் பர்பஸ் ஃபார் ஷேரிங் என்னன்னா, நான் சொல்றது கரெக்ட், நீங்க சொல்றது தப்பு அப்படிங்கறது. 1 minute, just a minute.
சார்
ஸோ அந்த மாதிரி உள்ள இது நம்ம இந்த மெடிக்கல் ப்ரொஃபஷன்ல பர்டிகுலரா கேக்குதா?
Can you hear me, sir?
Yeah, I'm hearing. Can you everyone hear my voice?
Yeah, sir, you're very much audible, and it is a very beautiful start with a nice positive message. Okay. Sir, I would like to inform you that this is a multilingual group, sir.
Okay, the thing சொல்லுவாங்க ஒரு எமர்ஜென்சி ஹாஸ்பிடல்.
Sir, it's a multilingual group, sir. You're very much welcome to talk in Tamil, sir, but I think we have to give a translate also in English so that everyone finds it useful, sir.
Oh, that's thing is we are sharing through Tamil, no, that I feel more better, I think so. So how most are English, most predominantly? Excuse me. Excuse me.
Sir, of all the participants who are present in this session of yours, mostly it seems to be an English language group, sir.
Okay, that's fine. So the thing is, so many different opinions over there we are hearing from our working place. The thing is, so today particularly I'm just plan to discuss about adult psychological issues, particularly after pandemic issues like COVID pandemic issues, and clinically my cases has been raised. So comparatively before and after. So today we are going to discuss about particularly adult psychological issues. So what we have to do and what are the major clinical symptoms and signs for adults. So we are studied and we know that many of articles and many of psychological issues and problems, we know that particularly the post-pandemic COVID issues, we are suffering many young adults anxiety and depression, and both anxiety and depression, particularly those depression, anxiety and stress. So many psychological issues they are suffering. So particularly young adult. Why I'm particularly choosing for 25 to and 30 years? There comes under for young adult and emerging young adults. So I classified, just a minute. So I'm just here. So how to choose front camera? Hello, sir. This
Front-
one.
Yes, yes, you can change the camera option in your mobile.
Okay. So start video. Okay. Can you everyone see? Can you able to see everyone?
Yes, we can able to see.
Yeah. So the thing is, so here I just made a graph how to be a like this is called as developing terms. So particularly we are choosing for my that particularly choose for adult, and this age is between 25 to 30. Why I am choosing for particularly this kind of age, so most before 24 years, so before 24 years, everyone has family dependencies, depending individually, most predominantly family dependent. They will support us for our education and higher and all purpose. They will support you from directly or indirectly. But after our completion of your UG course, we have to be stand our own leg. So we have to do the all basic needs and economically as well as our personal things also we have to do from our side. Once we are complete our graduations, we have to do we have to do search and we have to go for next level. So suppose after completion of our education, suppose we can't depend our family members. Suppose we feel shy, no, because of I chosen particularly the age between 25 to 130. So primarily most probably after 30 will go for the marriage. So most probably 25, 27 or 30 years will go for the marriage. So in that also we'll get mostly psychological problems. We don't know how to settle. We didn't get some proper job or how to manage the family, how to run psychological issues and how to overcome from all the components we will suffer. Concern choosing for young adult age, particularly the 25 to 35 years or so. So here our graph has been made. We already what are the psychological features we'll know because of the common young adult symptoms, for instance, skipped breakfast, liking fast foods, lack of interest in their physical fitness. So most of the of youngsters, their lack of interest in their physical complaints. They're not interested into physical fitness or exercise, and they're not interested to take all kind of physical fitness. Most young adults, they're preferring for alcohol and smoking, tobacco habitual, particularly sexual transmitted disease they are affecting. So these are the most commonest symptoms, and they are preferring to do for these kind of issues. And common here we are discussing about common clinical presentations. What their complaint says, feeling sad. That means that is called feeling sad is most probably belongs to those the depression, anxiety, and stress. Mostly we are facing day-to-day everyday life, and what are the component like stress or anxiety or depression based. But once we are not able to come from our psychological issues or our day-to-day problems, then that will become a problem for us. We have to seek for psychological counseling and psychiatrical pharmacological supports. We have to searching. Once we are not able to consult in proper timing and proper situations, that will make it for worsen psychological issues. So commonest symptoms here, the first one is called as feeling sad, and they're not able to, they always think overthinking and confusion thought. Third one is that is called mood swings always present. So mood swings means They will not take proper decisions. They're always in dilemmas moods. Sometimes mood swings is contain of so many symptoms, but we should get a proper histories. Mood swings comes under for which based and what are the dreams is comes. We have to get a case history accordingly. So once mood swings, we have to be diagnosed in right way. Once mood swings also is the present important clinical factor to provisional diagnosis. Okay. Fourth one is called as significant tiredness. They will take laziness. They always take plenty of time to take sleep. Dog, they won't prefer to take rest properly. Always prefer to dog. They never allowed to put light and not interested to self development. They're not interested to make self needness. So that is also the main problem for common clinical presentations. So varying sleeping patterns. So always sleepy, either it's sleep in the daytime or sleeping in the morning, or almost they prefer to sleep in daytime. Nighttime always they be wakened. So the common physical symptoms for depression. So first one is called generalized body ache and nausea. So bloating abdomen. So these are the commonest signs for depressions. So we know that no, so high blood pressure, the appetite or weight loss. Two things is there here. One is for whether they can weight increased or weight loss. The both symptoms has been. We have to be conclude. We have to be correlate whether after some particular days of symptoms whether the clinically the patient gained the weight gained or weight reduced. So based on that we have to be go through on the clinical diagnosis. Most commonest weight gain is for this some typical presences will be vary the person to person. Some most of the people prefer to for always they eat plenty of food and snacks, and others the always preferable to eat. No, that is the typical signs of stress. Some people they won't be eat. They always hesitate to eat. They never interest to take sleep, and they never take concentrate. They never concentrate in food habituals. So these are the commonest symptoms for depressions, and will signs for look. So always we'll go for the biopsychosocial. No, so we have to think on that aspects too. So here signs of symptoms. So what are the signs has been behavioral symptoms. So behavioral symptoms like sitting posture, whether they're listening or not, how they're dressing code, how they're that means their way of presence, their way of history telling, their way of sitting. We have to be look the behavior presence. So whether they concentrate, whether they are telling the clinical presentations is right, either the coherent clinical symptoms are incoherent. We have to be think in that aspects too. Next one is cognitive symptoms. So cognitive symptoms usually will interact, that what is today day, what's your name. We will ask attender persons who is related to you, what's her name and what his names, what relations you want. We have to get a clinical symptoms like what today, and we'll ask small adding and multiplications. We have to get an interaction in through cognitive symptoms, whether the cognitive is normal or abnormal. Is there any cognitive impairments? We have to be think. We have to get a clinical interaction is based on that signs and symptoms. So third one is called as emotional and psychological symptoms. So emotional bonding that is called as a emotional how they are interacting emotionally. They are expressing that is called crying symptoms or else how they are eye blinking or how they are interacting with any fear appearances. We have to be think in that. We have to look their facial presence also here, physical presence as well as facial presence over this place. This is called as emotional and psychological symptoms. So last one is sciences comes under for last one is for physical and medical symptoms. What are the physical and medical symptoms? So usually what we think, every symptoms like in anxiety or depression, so they always have a heart rate, increased heart rate. But suppose we should not think like that. we should correlate with medical symptoms. For example, if they have severe cardiac problem or respiratory problem, dyspnea, like that, in that condition also will have patient have tachypneic tachycardia. In sudden such a case also they have a medical problem. In that case, suppose we should not think that it comes under for physical symptoms or comes under for psychological symptoms. We suppose should not miss that kind of case. We should correlate in medical aspects too, and we get opinion from medical person like general medicine or psychiatrist. So is there any medical interventions? No, then let them decide, let them take a guidance, let them decide if they want uh, further treatment or inpatient care or psychological or pharmacological condition, that kind of aspects. So the medical person will decide. So most probably here the medical symptoms will missing in that kind of cases. We'll always think in our interpretations, in our pathways. So most probably the psychologist will think that it belongs to somatoform disorders, it belongs to psychosomatic disorders. So suppose we should not miss in that kind of cases. We should, if we have any doubts and based on that, better we'll refer for or we'll get our opinion from psychiatrist, or is there needed for any sleeping pills, or in such a case we have to refer psychiatrist. So what are the treatments we here choose for in young adults? So particularly what are the conditions we'll go for? So as per my diagnosis, and we always prefer for CBT. So comparative CBT will go for psychoeducation and REBT. It's ideal, and will go for gestalt therapy. So gestalt therapy is best for young adults. No, that will be easily understand, and we know, and we'll give the proper psychoeducation, and particularly will go for group therapy. So group therapy will give minimize the populations and will save our time. So we are comparatively choosing individual sections and one-to-one section. We'll choose for group therapy. That will be more better comparatively individual therapy. So you have to plan accordingly which one is best. So based on that affected population, based on that patient condition and situations. So next one is for what are the implications. So here I'm choosing for the only age between 25 to 30. We have to include for other age and below age, and above 35 age has to be improved. Then final ones paid, so many of myths are there, social myths are, so we have to overcome that myths, and we have to make more intervention. We have to make a more awareness about psychological treatment and psychotic mental health social worker awareness. We have to give public awareness. We have to give more public creating regarding about psychological treatment. What is the role for psychological awareness, and what kind of treatment we are providing, role of psychologist and role of medical social worker. We have to give this awareness for public. We have to contact many programs based on young adult, so that we are giving in that kind of young adult program that will minimize the psychological issues. So when we are conducting that kind of problem, that kind of programs, we can minimize particularly for young adult. So nowadays we are giving Alzheimer's disease. Who are belongs to Alzheimer's disease, they are getting remuneration from government 1,500. We have to hike that kind of case. We have to now the government plan to implement our psychologist and psychiatrist. We are suppose we are announcing, and we are pushing government to hike the remuneration 2,000 rupees, and additional policy we have to make 1,000 rupees for caretaker. So we have for additional 1,000 rupees for caretaker, so that what we will get now. So most predominantly the caretaker will give more care to Alzheimer's disease, who is suffering from Alzheimer's disease. They will take care of more and more. So in that government policy, we have to make awareness to public. 24 hours emergency psychotic casualties they are launched in Pudukkottai district. In not only that, overall we have to make a social awareness for all headquarters, particularly psychotic emergency, 24-hour psychotic emergency, and in that concern, individual Monday admission day for OG and Tuesday admission day for orthopedician, and emergency 24 hours emergency casualty service are there. In same every Thursday mental health cases has been admitted in all headquarters. In that kind of aspect, we have to give more awareness for public, and most of the people, they don't know when they're going for Monday for review, they'll tell them to come for Wednesday. Then again they're going for Wednesday, then tell them to come for Friday. So automatically, who are suffering mental health problems, they don't know where and which day has to go and get a consultation from psychiatrist. So in that case, government launched every Thursday for mental health case admission day for every headquarters. In certain things the people may not know, so we have to make a more awareness. So what is the exact conclusion for this aspect? So here the population's ratios are there, most predominantly young adult age. So particularly which was I am taken 25 to 30 years. So 49% of young adults suffering both. So this is called as anxiety and depression. So during COVID pandemic. So this is the main content we are discussing here. So what is the final conclusion of thoughts? So the thing is, common public mental health programs be more concerned making health policy for young adults. So this is the topic I has been interacted today. Anybody have doubt in this concern, you can ask.
Thank you very much, Chandrabose sir, for giving your thoughts and insights about how to care the mental health of youth. So now it's time for
Yes,
discussion. The participants, you can ask your questions. Sir, please feel free to talk in both languages, sir, in whichever you're convenient.
No problem, no problem. If they ask in English also, no problem to
People-
interact. Let
people in
them
the group are also-
ask.
Yeah, people in the
Good
group are
evening,
interested
sir.
to hear Tamil also, sir.
Good evening, sir. Anita Ramchandran here.
Yeah,
Sir,
yes.
நீங்க suicide preventionக்குன்னு ஏதாவது programs வச்சுருக்கீங்களா நீங்க?
இல்ல, no, I
Suicide
didn't.
prevention?
No, actually, the thing is, I just plan to post a paper for next national conference. So I prepare. So Sresha has been asked, so that I'm interact. Suddenly asked, so that I said, for okay, I'll take interactions based on young adult. So till I didn't contact any suicidal prevention program, but I'm having own clinic based on dealing about psychological counseling and assessment and interaction. In that kind of manner only I'm dealing. Till I didn't contact any suicide prevention, I didn't contact any program yet now.
Okay,
But
sir.
I attend national television, Zee Tamil, I attend a program based on suicide ideator versus psychologist and psychotist.
Okay, sir. Thank you so much.
Thank you so much. Any of others? Feel free to ask questions. I'll my suggestion. If I know, I'll say answer. If I don't know, I just say your opinion. It's not bothering about whether I'm knowing or not knowing. That doesn't matter at all. What we are learning from yourself or what we are learning from our group, that is only I need. So anybody have doubt, you can ask me.
So there is a
Thank
one
you very
question.
much. Yeah. Suresh, sir, please go ahead.
Yeah,
I just
sure,
wanted
sure,
to thank
sure,
him for his humble words.
Yeah, there is a
So there is
question
one
from
question in the chat box, sir.
சொல்லுங்க கேட்கலாம் சொல்லுங்க.
young adult faces pressure for education, career, peer and family pressure. How to help them to focus, especially for young people? What's your suggestion for that?
Sir, I'm not getting you. Sorry. Can you ask me once again? I'm not
Sir,
getting it because some.
So now youngsters
No.
are not. They are having the
No,
problem.
can you
in
ask once again?
So the youngsters are having problem in concentration. So what are the strategy you can suggest for them to focus or concentrate?
So most
Doctor,
probably நீங்க எந்த age, which means which age group of you're asking?
youth,
Because
young
we are
adults.
here, no, I'm just classified many ages are there. Just
College going students.
being that. So we see first the thing is what I'm suggesting, because of that we are initially we are we are discussed when the warning signs comes. Before that we have to interact with a psychologist or psychiatrist. Most probably psychiatrists, they don't have plenty of time to interact, so that they can consult psychologist. First one. Second one is they should realize whether they're having problem or not. So simply one thing I will tell you, nowadays the after January or after that means beginning of December, I'm getting based on the younger. That's what I'm choosing this topic to present. So even I'm having the proof, I'm having the number and all the details. So the here, what happened, one person is always stopping his bike and or 20 feet from my clinic to outside. So he will drop the bike and can walk and get a counseling and go back. My OP attendant guy noticed and tell me, sir, whenever he is coming, he dropped the bike and over 20 feet above after. So he come and consult. So I asked, why man, why you are keeping a vehicle long distance and coming by walk? Why? What happened? He is telling, no sir, I'm keeping my bike here. No, they always saying I'm a consulting psychologist. So these are the myths are there. So many myths are there. It's like comedy மாதிரி இருக்கு. என்ன நீங்க எந்த ஜென்ரேஷன்ல இருக்கோம், எங்க இருக்கோம், இப்ப நம்ம எவ்வளோ சைக்காலஜிஸ்டோட டிமாண்டிங் எவ்வளவு இருக்கு. நாங்களே லேக் ஆஃப் சைக்காலஜிஸ்ட் தான் இருக்கோம். ஸோ இன்னும் நம்ம ரொம்ப ப்ரொடக்டிவா ரொம்ப பண்ண வேண்டியது இருக்கு. இன்னும் அவேர்னஸ் கிரியேட் பண்ண வேண்டியது இருக்கு. நீயே 10 பேர்த்துல போய் சொல்லணும், சைக்காலஜிஸ்ட கன்சல்ட் பண்ண, அதுதான் ஃபார் பெட்டர். நீயே இப்படி சொல்றது எப்படி அக்செப்ட் பண்ணக்கூடிய? ஹவு வே யூ ஆர் டெல்லிங் லைக் திஸ், லைக் சைல்ட் இஸ் மேன், டோன்ட் திங்க் லைக் தட். ஃபீல் ஃப்ரீ டு இன்டராக்ட். Whenever you feel, you can come and you say, convey. Many of them get a consultation from psychologist. It's common thing. If you're having diabetic, you are getting consultation from diabetes. Why can't you, man? If you're having any tension-based tension or job-based stress, anything happen, you come and get a consultation. Whether even I'm doing my clinical service, who belongs to education like college age or a school age, now I'm giving the half concession. I'm not charging here. I'm charging a section here. I'm telling openly here. I'm charging for single cases per section. 1 hour, I'm just for 400 rupees. If they're coming student age group, I'm just charging for only half, 200 rupees only. I'm just saying. So whatever telling, just they have to initially, we have to think rationalized whether it is normal or abnormal. Once they're feeling abnormal, immediately they have to consult. And if they're feeling more abnormal, they can get a consultation from psychologist.
So can I just add on to this, Anita Ramchandran here? The other thing is that there's a lot of social stigma. The feeling of social stigma is always there when you have to consult a psychiatrist. So நிஜமாவே ஒரு ஹெல்ப் வேணுங்கிறச்ச they don't come forward to take treatment, and that can have a very bad effect. In fact, I think most of the suicides we can prevent if they come forward to seek help. They don't realize it, or the family doesn't realize it, and finally we've lost a member. It's too late to think about that. So this is what I think, that social stigma should not be there. I think mental health professionals have a very big role to play there. I think we have to, convince people. This is what, because people avoid a psychiatrist or a psychologist or a social work, person with a social work.
The thing is, you are right, ma'am. Actually, I would just want to talk to you many ways of there. So here, only la simple open ஆ சொல்றேன். நம்மளுக்குள்ள எவ்வளவு அசோசியேஷன் கிரியேட் பண்ணிருக்கோம். ஸோ நம்மளே ஆக்சுவலி நம்மளோட ரோல் வந்து சைக்காலஜிஸ்ட், சைக்காட்டிஸ்ட், மென்டல் ஹெல்த் சோசியல் ஒர்க்கர் நம்ம ஒரு களத்துல இறங்கி நம்ம இது பண்ணணும். இன்னும் இதை பத்தி ரொம்ப பேருக்கு சோசியல் மிஸ் ஸ்டிக்மாஸ் நம்ம இதை ஒரு அவேர்னஸ் கிரியேட் பண்ணோம். ஏன்னா பிகாஸ் நேத்து கூட ஒரு பேங்க் மேனேஜர் போய் பார்த்தேன். அவரு உண்மையாவே இடணும் நான் வந்து மேனேஜர் நம்பர் இருக்கு. நேத்து கூட அவருக்கு வந்து பேச அவரே ஷாக்கிங். ஓ சைக்காலஜிஸ்டும் சைக்காட்ரிஸ்ட்க்கு இவ்வளவு டிஃப்ரெண்ட் இருக்கா அப்படின்னு சொல்லிட்டு அப்புறம் நான் ஷேர் பண்ணேன். சோ இப்ப நம்மளுக்குள்ள இவ்வளவு பார்ஷாலிட்டி இருக்கு. பட் ஆனா உங்களுக்கு தெரியாத ஒண்ணு இல்ல, நம்மளுக்கு தெரியாத ஒண்ணு இல்ல. ஹூ என்ன சொல்றது, எவ்வளவு லேக் ஆஃப் சைக்காலஜிஸ்ட் இருக்கும், சைக்காட்டிஸ்ட் எவ்வளவு டிமாண்ட் இருக்கு, பர்டிகுலரா மென்டல் ஹெல்த் சோசியல் ஒர்க்கருக்கு, சோசியல் ஒர்க்கருக்கு, சைக்காட்டிக் சோசியல் ஒர்க்கருக்கு எவ்வளவு டிமாண்டிங் இருக்கு. அது மட்டும் இல்லாம இன்னும் நம்ம ஸ்கூலுக்கு சைக்காலஜிஸ்ட் அப்பாயின்மெண்ட் பண்ணவே இல்லை. ஈவன் தோ அப்பாயின்மெண்ட் பண்ணிருந்தாலும் ஒரு டிஸ்ட்ரிக்ட்ல மினிமம் 50 ஸ்கூல்ஸ் இருக்கும். போத் கவர்மெண்ட் அண்ட் that means private. So private க்கு போறது இல்ல, கவர்மெண்ட் மட்டும் தான் டீல் பண்ற ஒரு சைக்காலஜிஸ்ட். அவர் சொல்றாரு என்னால 50 ஸ்கூலுக்குமே போக முடியல, அட்லீஸ்ட் 30ஆவது இருக்கும். அது ஒரு டிஸ்ட்ரிக்ட்னா நம்மளுக்கே தெரியும், 10 வில்லேஜஸ் தாண்டி அந்த வில்லேஜுக்கு போறதுக்கே 40 நிமிஷம் 1 hour ஆகும். இந்த சைக்காலஜிஸ்ட் போய் அந்த ஸ்டூடெண்ட் அசஸ் பண்ணி அந்த ஹிஸ்டரி அவரால் எப்படி முடியும்? ஸோ இதுக்கு இதுதான் நம்ம சொன்ன இந்த பாயிண்ட்ஸ்ல ஹையர் பண்ணது என்னன்னா, இன்னும் மோர் சைக்காலஜிஸ்ட் ஹையர் பண்ணணும், ரெக்ரூட் பண்ணணும், இதை பத்தி அவேர்னஸ் கிரியேட் பண்ணணும். ஸோ அப்ப இது எங்க பேசிக்காவே எங்க இருந்து ஸ்டார்ட் ஆகுதுன்னா, நம்ம சைக்காலஜி ஃபேமிலில இருந்தே ஸ்டார்ட் ஆகுது. நம்ம சைக்காலஜிஸ்ட் எல்லாமே டிஃப்ரெண்டா பிரிஞ்சு இருக்காம எல்லாம் ஒரு ஃபோரம் கீழே வந்து, இன்னும் தெரியல இதுல நான் ஏதாவது ஒண்ணு சொன்னா மறுபடியும் இன்னொரு பெரிய ப்ராப்ளம் வரும். கிளினிக்கல் சைக்காலஜியே ரொம்ப டிஃபரன்சியேஷன் பார்ஷாலிட்டி பார்க்கணும். நீங்களா அந்த சோசியல், அது மட்டும் இல்லாம எல்லாமே ஃபர்ஸ்ட் ஒன்னா இருக்கிறதுனால இந்த சோசியல் ப்ரோக்ராம், அது மட்டும் இல்லாம இன்னும் கொஞ்சம் ரொம்ப ஒரு புரியல. எஸ் சொல்லுங்க.
Will you speak in English?
Yeah, that's what. No, the thing is, no, so many forums we are separated here, so many associations created here. So we have to work for on the name of psychologist. We have to work under some roof so that we can give more public awareness. We can create more psychological based program so overcome from myths or social stigmas. It's right.
Yes, Anita san.
It's right. Anita Ramchandran, something who has been interacted in last. Yeah. Okay, fine.
Yes, sir.
Okay. Anything else?
Fine, sir. Now, Dr. Chandra, over to you.
Suresha?
Yes, Dr. Chandra. Yeah.
Suresha?
Talking to you, Chandra Bose, sir. Can you hear me?
Yes, you can continue.
Sir, Chandra Bose,
Yes. Tell me, ma'am.
Sir, we are just in the conclusion part of today's session, sir. We don't have more questions in the chat box to discuss. And so now
Yes.
I'm happy to give you the words of thanks for your session, sir. First of all, my appreciations for bringing this topic today and being very frank in discussing whatever you have felt, sir. We are humbled with that. Thank you very much. And also, I like the idea of you suggested staying together to bring awareness with people so that it could bring a nice social change regarding mental health or whatever. Thank you very much for that idea also, sir. So on behalf of the core team and also the organizers of this webinar series, we give you our heartfelt thanks. And also we thank all the participants who have been present this evening to interact and discuss more on this topic. So thank you one and all present this evening. See you all tomorrow in another session, the same time, same link. Until then, it's me saying bye-bye, good night.
Thank you so much. Thank you.